My name is Russ King. I'm with a company called MethodSense. We're located here in the park. Our job is to help companies through the commercialization process, or to help manage the commercialization of their products. We're a device company, a device-oriented company. We work with other products. So all I have to say today is really device-oriented. Thank you for being here. Thank you for staying. I know that you've had a long day. Like the speaker before lunch, this is not going to be a particularly technical, from a scientific perspective, technical discussion. Maybe your brain will get a break as we sort of move forward. So the topic of the conversation was regulatory approaches for new technologies. And to kind of kick that off, I want to engage a little cooperation. Anybody in here who has on them now a smartwatch, please raise your watch. You have one, raise your watch, you've got one. Okay, keep your hands up. Anyone here who has a smartphone, please raise your hand. Virtually everybody. Now that's representative of populations domestically, internationally, and globally. And so, well, what does this mean? Well, if you talk to technology gurus, you talk to the people who make the devices that you're wearing or carrying, you talk to, even look at their press, you talk to scientific experts. If it isn't today, in the next generation of these products, you will have on your wrist or in your pocket or on your pocketbook a medical device. So everyone's going to be transported from being consumers of these electronics to having on their body at all times a medical device. Now that's changed. When it comes to new regulatory approaches to new technologies, that itself represents a change, and a new change. And everybody recognizes that this is coming, and a lot of the reasons for it is centering around the miniaturization of technology, the ability to incorporate those miniaturized technologies into wearables such as fabrics or watches, or into consumables like your cell phones. And the FDA has recognized that this is an important change. Imagine 10 million people sending up to the cloud every single day an echocardiogram. Do you think you can do something with that data to learn something about heart disease? In all likelihood, yes. That's a lot of data to crunch, but there's certainly more than 10 million cell phones out there, 10 million smartwatches, so the capability of collecting that kind of data sampled daily is certainly going to be there. Imagine that you took your cell phone, you put a little device on the end, and you're able to collect an assay that took a sample, and from that sample you could distinguish in the sample precancerous cells. Now that's also remarkable, particularly for things like pancreatic cancer, which kind of has not such a quick onset. To be able to identify those when those cells emerge and learning how to deal with those cells is really quite promising and intriguing. And there are all sorts of other strange consequences that will come from this. So for example, you go to the opera and they say, turn off your cell phone. You say, turn off my medical device? No way. So there's all sorts of dimensions to society that this will change, that will be a big part of, and the FDA recognizes this. They say that we're taking the potential for these things as being transformative. Not only transformative to healthcare, but how healthcare is even delivered. Your cell phone, you can talk to your doctor there, see his face. You can look at yours. You get data. You can maybe prescribe there right then and there. So it's very, very important and very, very transformative. It's interesting perhaps to talk a little bit first about what new means in the context of regulatory approaches. New doesn't mean unique. Your cell phones aren't unique, but how they might behave might be unique. It's not like a blocking patent that you can skirt by with a little wordsmithing and stuff like that. It's nothing like that. What new means in terms of regulatory approaches involves whether or not it's new to the FDA, and then trying to figure out how that new thing to the FDA fits into their regulatory schema, as it were, the regulatory road paths that they might have. So I'd take a couple of minutes to talk about some humdrum topics like 510Ks and things like that very, very quickly. you would expect them that the traditional pathways that the FDA has for clearing products can accommodate new things. We don't normally think about that, but they can accommodate new things. So if you have complaints about the language on this slide, I accept it. It's not very precise. It's merely designed to help convey an idea. And the idea is that if you have a traditional 510K, we all know that its intended use is going to be identical to what's called a predicate device. But that doesn't mean there isn't possible to have something new about that device. There can be technological differences between the 510K device and its predicate, and then your job is simply to flush out why those technological differences don't make a real difference when it comes to risk. So that's your job, and you get through the 510K, and you're done and happy and in the market. There's another 510K process, a non-traditional process called de novo. And this is a fairly recent pathway for the FDA. De novo process will include a device that has no predicate device. That is, its intended use is not identical to any previously cleared device and their intended use. So it's a new use. That's what the de novo process involves. And it might, not necessarily, but it might involve some new technologies. So here again is another case in which the FDA has a way to digest something new in its traditional pathways. And then, of course, there's the dreaded PMA or pre-market authorization, which entails, it's typically very, very high risk, very often new technologies, very often a new intended use or indications of use. And so you're dealing with really new kinds of risk that the FDA has to digest. But here the point is, with apologizing for the imprecision of the language, the traditional way in which the FDA works, they certainly have ways to manage new stuff. But that's not the only way they manage new stuff. Another way that they manage new stuff is with particular kinds of documents that they publish on a regular basis. They call them guidances. And guidances aren't regulations. Guidances are documents that express how the FDA thinks. Guidances, you can deviate from guidances, but when you do, you better make sure that your arguments are better than the arguments that the FDA has, because they're telling you what arguments are good ones from their perspective when they publish a guidance and it's out in the marketplace. Different kinds of guidances that we've seen recently. Medical device data systems, or MDDS. Medical device data systems were 6 years ago a class 3 device. Then they turned to a class 2 device. Then they're a class 1 device because, in the estimation of the FDA, their risk got lower. So we have lots of new technologies that is taking data from medical devices and moving them someplace, not doing anything with them, just taking them and giving them to people like doctors or laboratories or things like that, with no substantive alterations. And instead of being a class 3 device, they're now class 1 devices subject to enforcement discretion. Enforcement discretion is the FDA speak for saying, we're not going to really pay attention to it unless you bring attention to yourself. And so where they'll go through this process of assessing technology and trying to respond to how they deal with it across time. And medical device data systems as a guidance is an example of that across time, and trying to adopt, accommodate, and adjust to and appreciate that this technology is or is not a risk, and let's behave accordingly. Mobile medical applications guidance is another one which tries to identify those mobile medical applications that they will want to regulate and why. Draft guidance for regulatory oversight of laboratory developed tests, very hot topic now, in draft mode. Proposes regulating laboratory developed tests, moderate and high risk tests that previously were under enforcement discretion. And there are a lot of other guidances that are out and coming out this year. These are current topics. My favorite is applying human factors and usability engineering to medical devices. Does it make a difference if it's usable as the manufacturer intends? Yes. If you make a mistake with it and harms people, that's a problem. So you better make it usable for the people who have to use it. But again, the idea here is very simple, and that is the FDA responds to changing technologies with things like guidances if their current regulatory pathways do not accommodate new technologies very well. There's also something else in the landscape that's important to realize and pay attention to, and that the FDA is not the only people who do this sort of thing. Our congressmen and senators, they do it too. And oftentimes they'll do it to the FDA. They'll tell the FDA what they can and cannot do. And by examples for that, there are current, in the Senate, 7 bills. They're linked to device regulation and drug regulations. They're going to tell with these bills, if they pass, what the FDA will and will not do. You would think, what do senators have in knowledge to do that? I'm not sure. Maybe their constituents might know a few thing or two, and that's what they're doing on their behalf in all likelihood. 21st Century Cures Act was a big one, House proposed legislation. There's a bill out in the House right now that actually requires physicians, if it passes, will require them to report an adverse event. So some legislation puts more burdens on people. Another alternative House bill is proposing that you can sell medical devices under the Investigation Device Exemption Act, which makes it easier to sell. So some legislation makes things more burdensome from a regulatory perspective. Others take it away. So you've got a lot of the private sector getting their hands in the pot, saying this is what you do when you, from a regulatory perspective, manage your medical device or drug or biologic. But they're not necessarily the biggest drivers in all this. The biggest drivers that we see as a consulting firm in this arena are companies. And it's interesting to note that the miniaturization of technology and the ability to proliferate and distribute medical devices in consumer goods has enabled large consumer companies to very easily get into the medical device market, be a part of healthcare. And that is also new, very, very significant. It's not just that you have these products that are going to be a medical device, it's that you have large companies who will be in the medical device and healthcare market where heretofore they have not been. And here's some quotes from some large companies that could have an impact in this regard, and particularly where big data is concerned. I've always believed that the data is trying to tell us what the answer is, so we need to know how to listen to it. That's where computation comes in. We all know who this is. If you think about some of society's biggest problems and challenges, one of the ones that we're really focused on is health. We're really focused on that, right? How many people here have a Series 2 watch? No one has a Series 2 watch yet? Well, that Series 2 watch is now a fitness watch. It's half a step away from being a medical device. The Chan Zuckerberg Initiative, most of the big breakthroughs that have happened through the history of science are not done by a single person, but they're done by groups of scientists either working together or working separately and sharing data or building tools to push the whole field. And his intention is to take money, build an organization, and push the whole field. That's what he wants to do. He wants to do the pushing himself. We are using Google Glass to beam our specialists down to us in the emergency room medical department. Great virtual medicine, particularly with these kind of tools, delivering real-time advice, assistance, and help, sounds fabulous. I think that the promise here is just unbelievable. It really is transformative, lives changing. But I'm frequently reminded when I think of these terms of a conversation I had recently with a Fortune 10 company. And we were in a conversation, and at the end of the day, one of the executives said, look, we're not a medical device company. We're a company that makes a medical device. I said, great, that's good to know. He says, no, listen to me very carefully. We are not, and we will not be a medical device company. We're a company that makes a medical device. Now, what did he mean by this? He meant that the company became what they were because of self-determination, not because their end goals and points were prescribed by a regulator. They became what they were because of the way they wanted to do something, the way they wanted to make products, sell products, manage their products. And what they're trying to say is that when we make medical devices, we're going to do absolutely everything we possibly can in order to continue on our path of self-determination. And what does this mean for the FDA? It means they will try to not comply with the FDA as far as they can. And this is a kind of company that could sit up one day after a Thursday management meeting and write a check for $1 billion and say, go make this happen to me. So one question to ask yourself in a social dynamic way here is, what impact will that have on regulatory pathways to the marketplace? Will it have an impact? I believe it will, because when they're able to lobby all your congressmen, when they're able to lobby the FDA, when they're able to communicate with their consumers, the people who buy their products, that we want to be a certain way and a certain thing for your benefit, then I think they will make some headways in managing the FDA and getting them to do what they want them to do and the way they want them to do it. They will make some headway. What that is, I don't know. Now imagine even further, and this is an unlikely but a scenario we can at least postulate, that Samsung, Google, Microsoft, and Apple all get in a room and say, instead of spending $1 billion, why don't we spend 30 and coordinate our efforts across all spectrums of these sorts of activities? Don't you think we could get to where we want to be? And the answer is probably, yeah, they probably could. And the only question that I'd leave you with is that a prospect that makes you holding in your pocket or on your arm a safer person, because that's a possibility. So that's it. Thank you very much.